How many different carriers are there today that a person could choose from?
Well, I say Main Street carriers in our marketplace. There's probably a half a dozen that are very good.
So if I look at those half a dozen carriers and you use the F and the G, but if you buy the F plan or the G plan from any of those carriers, they're going to be identical as far as your benefits across the board.
Exactly correct. Yes.
Right. So at that point in time, would it make sense to say, well, the only differentiator then is going to be premium? Is that a smart way to look at it, or are there some things that people need to watch out for if they think of it in that term?
Dean, there's always a yeah, but you need to consider the fact that premium is important. And if I look at the top, let's say I look at the top 6 supplement carriers, and I do my homework and I list all the premiums. The premiums are not going to be greatly different. There's a fairly significant compression of premium from the Main Street carriers.
What are you talking about? Within 2 or 3% of each other? Or?
Oh, maybe more than that, but not a significant. It may be a $15, $18 a month difference in premium.
Okay.
And if all things being equal, and I can save $18 a month times 12 months, isn't that a good choice? And the answer is maybe.
Starting your route to retirement.
Welcome to the Guided Retirement Show. I'm your host, Dean Barber, founder and CEO of Barber Financial Group. Isn't it crazy that as we age and our cognitive abilities begin to decline, that things get so much more complicated? Welcome to the alphabet soup of Medicare. Joining us today, Tom Allen. He's a repeat guest, and we had Tom on episode 1 of the Guided Retirement Show. In fact, I think it was one of the most listened to episodes of season 1. Tom broke down for us in season 1 what Medicare is, how it works, how it was started. We talked about the different types of supplements that are out there, but we didn't dive too deep into the supplements. Now, on today's episode of the Guided Retirement Show, we're going to take a deep dive. We're going to look at the difference between a Medicare supplement and a Medicare Advantage plan, who should do what, and a lot of rules that even though you may think you know, you probably don't. And this is an episode that you're definitely going to want to share with all of your friends and relatives. Look, everybody knows somebody who is either approaching Medicare age or is already of Medicare age, and the decisions that you make or fail to make in this uber complex area can mean tens of thousands of dollars over your lifetime. Please enjoy my conversation today with Tom Allen. All right, Tom, welcome back to the Guided Retirement Show. You know, in season 1, where you and I talked about the basics of Medicare and what people really need to know, I think we laid a really, really good foundation for understanding Medicare and how it works and what it's designed to do and what it's not designed to do. And anybody that didn't get a chance to listen to our 2 episodes in the first season of the Guided Retirement Show should really go back and listen to those first as just a baseline for Medicare. This is a complicated topic.
It is.
You live in it, you breathe it every day, and even before you started specializing in the Medicare and Medicare supplement area, you spent decades in the health insurance arena. So to you, this is second nature. To the people that are listening here to the Guided Retirement Show, the things that you and I are talking about are sometimes they're foreign, and it doesn't really, it doesn't really make a whole lot of sense to them. And so, I'm one of those guys. I'm not Medicare age yet, so I try to know as much as I possibly can about it because I've got a lot of clients that are there. But let's go into the different types of Medicare supplements, because there's what Medicare pays for, and then there are the supplement plans or the Advantage plans that people can choose from. So walk us through pros and cons. First, let's start, Tom, with what's the difference between the Medicare supplements that are out there, and we'll leave the Medicare Advantage plan to a later part in a conversation.
Well, Dean, if you're eligible for Medicare, you actually have 4 choices. The first choice is to go with traditional Medicare A and B only, and a lot of Americans are in that situation. And Medicare doesn't cover everything. Medicare B pays 80%. So just having traditional Medicare Part A and Part B is, for most of us, not enough. Now, there is a premium that we talked about in the earlier podcast for Medicare Part B. For some Americans, the premium is too much of a percentage of their Social Security check, and they simply cannot afford to go on Medicare Part B.
And again, Part B, just for those people that maybe didn't catch the first.
The outpatient side.
Yeah, so that's your outpatient.
The outpatient side. Part A is inpatient. So for the people that can't afford a Medicare Part B premium, if they only have Medicare Part A, and to kind of back up, Medicare Part A premiums are prepaid with the FICA contributions you and your employer had over the course of your working years.
So that's that 3.7% or whatever it is.
So and the point is that they won't have an additional premium. They have prepaid their Medicare Part A premium. Henceforth, there's nothing coming out of their Social Security check. For the Part B premium, for many Americans, it's just more of an expense than they can afford.
What happens if they don't have it? Then they have nothing covered for the outpatient?
Essentially, that's correct.
Unless you go out and buy a private insurance policy.
Unless you do, and most of those people, if they can't afford a Medicare Part B premium, they're certainly not going to be able to afford a supplement coverage. But there are other programs, low income subsidy, Medicaid. There are other safety nets that some of those people will qualify for. And I was talking to a lady who said, "Oh, I just can't. I could never do that. I could never go on welfare," and it's a stigma from her childhood and so forth. And I explained to her that those programs exist specifically for people that find themselves in the circumstances they're in. So don't hesitate to utilize it. And it can be pretty confidential. So you can have those programs, that safety net under you, and your next door neighbor may never know unless you told them.
Right.
But so you have your four choices. You have Medicare Part A and B. You can go to a Medicare Advantage plan if you have the Medicare Part B, or you could go to a supplement plan if you have the Medicare Part B.
Okay, so this is where it starts to get a little bit confusing to me. The supplement plans, there's a number of different insurance companies out there that offer Medicare supplement plans. What's the difference in the carriers?
Dean, the again, kind of backing up slightly, when Lyndon Baines Johnson signed the Medicare Act in 1965, the insurance entity quickly recognized that Medicare didn't cover everything. And so they decided that they would come up with policies that would supplement Medicare or cover the gaps that Medicare didn't cover, Medigap, supplement, tie-in plans. All three mean the same thing, which is confusing in itself. At that point in time, there were a couple thousand insurance companies selling health insurance in this country, and they all came out with their 4 or 5 or 6 choices for their menu for you to select from. So in 1966, a person retiring had their choice between 6 or 8,000, or maybe more, choices. And if they,
it's a little narrower than that today.
Well, fortunately, and so in that scenario, if a person purchased the best Medicare supplement plan available, it would have been accidental because there were just so many choices. So the government stepped in and said, "We're going to standardize the benefits. This is crazy. This group of people shouldn't be this confused over all the choices with Medicare supplement plans." So they standardized all the benefits, and they listed them A through N, not 1 through whatever. Even though we have Medicare Part A, now we have a supplement choice A. We have Medicare Part B, we have a supplement plan choice B. So if our intent was to make this a crazy, difficult system to understand, well, then they get a gold star that day. But when the government stepped in and standardized the Medicare supplement plans, it mattered not which carrier. If you purchased an F plan or a G plan, the benefits are exactly identical. Exactly. So, but the government said, we don't care what you charge, whatever the market will bear. So premiums will vary from carrier to carrier, from supplement provider to supplement insurance provider, but the benefits are identical. That had to happen.
All right, so how many different carriers are there today that a person could choose from?
Well, I say Main Street carriers in our marketplace. There's probably a half a dozen that are very good.
So if I look at those half a dozen carriers and you use the F and the G, but if you buy the F plan or the G plan from any of those carriers, they're going to be identical as far as your benefits across the board.
Exactly correct. Yes.
Right. So at that point in time, would it make sense to say, well, the only differentiator then is going to be premium? Is that a smart way to look at it, or are there some things that people need to watch out for if they think of it in that term?
Dean, there's always a yeah, but. Yeah, but you need to consider the fact that premium is important. And if I look at the top, let's say that I look at the top 6 supplement carriers, and I do my homework and I list all the premiums. The premiums are not going to be greatly different. There's a fairly significant compression of premium from the Main Street carriers.
What are you talking about? Within 2 or 3% of each other? Or?
Oh, maybe more than that, but not a significant. It may be a $15, $18 a month difference in premium.
Okay.
And if all things being equal, and I can save $18 a month times 12 months, isn't that a good choice? And the answer is maybe. and by that, when you're first to be eligible for a Medicare supplement plan, I mentioned you have to have Medicare Part A and Part B, and you need to maintain Part B. But when you look at a supplement carrier, the benefits are the same, and you look at the premium. But I guess the point I want to make is you have a 6-month window of time from when you first became eligible for Medicare and went on Medicare to enroll in a Medicare supplement plan, to purchase a Medicare supplement plan without underwriting.
All right, so that eligible period is the day you reach age 65 until 6 months after that, or what's your period there?
Well, the clock starts ticking on the effective date of your Medicare Part B.
Which is what?
Well, it can vary. Usually, when people age in, our term for turning 65, and they apply for Medicare Part A and Part B, the effective date would be the first of the month, generally speaking, when they turn 65 and the benefits are put in place.
So you're saying that just turning 65, Medicare doesn't just turn on automatically Part A and Part B? Do you have a choice to delay Part B till later?
Sure. And many Americans are working past age 65 for a variety of reasons.
So they don't need the Part B yet.
They do not need the Part B yet. And remember that there's a premium for Part B. And our government recognized that if you're under employer group coverage for you and your family, in most cases the employer does not pay 100% of the premium. The employee is contributing some dollar amount to the premium. The government recognizes that having Medicare Part A, Part B, and group coverage is a duplication. So the government wisely said, why would we ask you to pay $135.50, which is the base premium for a Medicare Part B currently, as well as contributing to your group health plan when they're duplicate services?
So Tom, that's interesting because you've probably run into this before. I know I've seen it a lot of times where people are working past age 65, and for some reason, they've already turned on that Medicare Part B. Is it because that they didn't get good counsel from the Medicare office when they signed up for their benefits? Is it because they just thought that they had to sign up for both? I mean, I
think both of those are true, Dean. And I think it's also a situation where people will, if they can easily afford the additional premium, even though they're contributing to their employer's group health plan, they think, well, why not? Why not go ahead and put this in place and have the coverage and I don't have to worry about it down the road. And the flaw in that is that when they received Medicare Part B effective date, when it went in force, that started the 6-month window of time that they would have no underwriting.
So is there a point at which you have to start Part B or you're not eligible for it anymore? In other words, let's say we know there's people today that are working into their 70s. So, like Social Security as an example, you're eligible as early as age 62, but you're going to take it at age 70.
Yes.
Right?
Yeah, because there's no additional reason.
So does the Medicare Part B work the same way? Is there a point in time at which you have to start or you lose your opportunity to get it?
There's not a point in time when you have to start. Medicare doesn't have a law stating that by this date you have to take Medicare Part B. If you're continuing to work past age 70, and many people do, and you have coverage through your employer, and which again is very common, there's no reason to have Medicare Part B premium to face. The point I want to make is if you choose to go ahead and take Medicare Part A and Part B and continue working, you will see that 6-month window of time where you could go through no underwriting come to a close. People have retired past 65, 67, 68, 72, whatever the case may be. They want to go on a supplement plan, and they now face underwriting, not realizing that they had a 6-month window of time, and they began the clock when they accepted Medicare Part B. 6 months later, the no underwriting part goes away.
And so let's just paint a scenario, Tom. Somebody reached age 65, they continued to work, they went in ahead and did what you just said. They signed up for Part A, they signed up for Part B. Now they work another 3 or 4 or 5 years, and all of a sudden, okay, now I'm going to retire. I'm losing my company-sponsored health plan. I want to go get now a Medicare supplement to supplement my Part B because it only pays 80%.
That's right.
But you're saying they may not be able to get a supplement plan because they have to go through underwriting. So if they've gotten some illness that precludes them from getting underwritten, they may not be able to get a supplement?
Dean, that's right. And recognize that a supplement carrier is an insurance company. They look at the premium coming in. They look at the potential claims going out, and in a sense, you stop becoming a breathing human being. You now become a statistical analysis for that insurance company to decide, is the premium going to be profitable for us based on the potential claims that we now recognize. It's like a house with smoke coming out from under the eaves. Chances are there's going to be a claim.
I guess an easy way to think about this is that you can qualify for a Medicare supplement for Part B without going through underwriting, so with pre-existing conditions,
yes,
as long as you apply for that Medicare supplement within 6 months of the time that you have applied for Medicare Part B.
When it goes in effect.
Yeah.
That's right. So let's go back
I don't know that that's really common knowledge, Tom.
Well, I don't think it is. And right now, we happen to be in the annual open enrollment period, October 15th through December 7th. And you don't really need a calendar to know that's occurring. You turn on the TV, and 9 out of 10 commercials are on a Medicare Advantage plan right now. And I've heard many of the commercials say, this is the time when you can make a change in how you receive your Medicare coverage. And that's sort of correct. It is sort of correct in the fact that if you have a Medicare Advantage plan, and I think we're going to chat about that shortly, or if you have a Medicare Part D, the prescription drug coverage, during that time period, you may freely move from carrier to carrier. The exception under the Medicare Advantage plan is there is always going to be one underwriting question. Do you have end-stage renal disease? And if you do, you're not going to be able to make a change to another Medicare Advantage carrier.
Is there more than one Medicare Advantage carrier? So let's not confuse the subject, because we're going to get into the Medicare Advantage stuff here in a few minutes. But let's stick to the Medicare supplements. And you've talked about Part A, Part B, but that doesn't cover prescription drugs.
Doesn't cover prescription drugs. Medicare supplement plans do exactly what the name implies. They supplement Medicare. Medicare does not cover prescription drugs with a very few exceptions, and most of those are what's classified as Tier 5, usually administered in a hospital setting, occasionally in a clinic or a physician setting. But when you think about the Main Street prescriptions that we take day in and day out,
they're not covered.
They're not covered.
So what does a person do then? How do they get their prescription drugs covered?
If they go the route of a Medicare supplement plan, they need to back that up with a Medicare Part D prescription drug plan.
Okay, now does the Medicare Part D prescription drug plan, does that carry an additional premium over the $135 a month of Medicare Part B?
Dean, it does. But let me point out that the Medicare Part D does not come to you through Medicare. That is a private insurance policy, not unlike a supplement plan, where you would purchase that Part D carrier from a carrier, an insurance carrier, and there is a premium. I tell people for a budgetary standpoint, when they're looking into going into Medicare, they should budget about $25 a month for that premium for the Medicare Part D.
Okay.
And with the Medicare Part D, that does not imply that all of their prescriptions are provided without an additional cost.
All right, so let me ask a question, because this gets into something that's, I think, super sensitive, and that is what prescriptions are covered by what Part D supplement carriers are. Has this been standardized as well? So every single Part D carrier has to provide the same prescription drug benefits, or are some companies or some insurance companies providing different prescription drug benefits? In other words, they'll cover some prescriptions, but they won't cover others.
Dean, they have not been standardized.
So this is critical.
It is critical. And unfortunately, it's kind of a liquid landscape. The prescriptions I'm going to take next year may be different than the prescriptions I'm taking this year.
So what
Things
if you get
change.
that? What if you get that pre-existing condition where you're starting now? You weren't on a prescription drug, and the prescription drug plan that you had was fine. Now all of a sudden you're taking new prescriptions. Do I have to wait until open enrollment to go out and find a new prescription drug carrier? And if so, will they take me if I already have that pre-existing condition?
Dean, the answer is yes. You have to wait till open enrollment period, October 15th through December 7th, and the effective date will be January 1st of that following year. What I tell people to do when they're picking out a Medicare Part D plan, the best advice I can give them is to go to Medicare.gov website. Very friendly, created for our age group. And I can build a profile. I put my name, I put my gender, I put my zip code, and I can list all the prescriptions that I'm taking. Medicare.gov will give me a printout, if you will, of which plans most closely match my current prescriptions. And going back to what you asked, do all plans cover all prescriptions the same? And the answer is no, they don't. The example, and we mentioned this in our earlier podcast, the example I use, if there's 41 prescriptions for high blood pressure, a Medicare Part D carrier does not need to provide all 41, but they have to provide a minimum standard, which is designed by Medicare. So let's say that there's 30 of the 41 that they're going to offer. Translate that means in that example, there's 11 prescriptions that this particular carrier is not covering, although they're providing 30 high blood pressure tablets. If you and your physician have gone through the process of picking out the prescription that gives you the least amount of side effects, the one that you and the doctor feel that you need to maintain, the first question I would ask is, does this new Part D carrier cover that specific brand name? By going to Medicare.gov, it's going to tell me if they do or if they don't.
Okay, so let's say that I'm a person that's already on Medicare. I've got my Medicare Part D plan. I go on to Medicare.gov, and they're not going to cover this plan that my doctor says is the one that I need. What do I do? I wait for an open enrollment, and then I go in and switch to a carrier that covers it? Can I do that?
Dean, you can. Unlike, there's no underwriting for the Medicare Part D. You are free to change from carrier to carrier each year during the annual open enrollment period.
So it sounds to me like you could have a different carrier for your Medicare Part B supplement and then a different carrier for Medicare Part D.
That's correct.
So it doesn't have to be the same insurance company.
And sometimes it is. Generally speaking, it's not. And since things change in our prescription drug usage during the course of the year, it's very, very wise for people to go back to Medicare.gov and reload the prescriptions that they're taking, and to see if there's another carrier now that better fits their needs.
You know, so what's so interesting to me, Tom, is in season 1 of the Guided Retirement Show, I did an interview with a lady by the name of Bree Williams, and she specializes in the cognitive impairment that people face as they age and how much more difficult it becomes to comprehend and make decisions and those types of things. It's just a natural part of our aging process.
Sadly.
And it just blows my mind that we can make something so complicated for somebody who's in a stage of life where their abilities to comprehend and understand and take it all in are declining throughout their life. And so I think it's critical. Here's what I think. I think that if you have adult children, that the adult children need to be listening to the Guided Retirement Show here, and especially this podcast and the other ones that we did on Medicare Supplement, so that they can help coach their parents.
Dean, I couldn't agree more. And sometimes it's friends, neighbors, church members. Sooner or later, we're going to all recognize that we're all in this together. And we have to start looking out for the people that need more assistance. You can go to people, brokers and agents such as myself, and certainly we're happy to help them. Some people feel that their healthcare issues and the prescriptions they take is confidential, and they tend to be private about that. And I get it, but the potential expense that they're possibly going to have during the course of the year can be devastating. And I don't say that lightly. Prescription drugs are almost the tail wagging the dog for many health issues that we have today. There's reports that say 50% of Medicare recipients that have a significant illness or issue that they're dealing with, their prescription drug cost is devastating to them on an annual basis. And your point's correct. It's confusing. And if there's a better answer to their problem, then I would encourage them through their children or through another source to each year reevaluate their Part D carrier.
So that profile that you said you can go on to Medicare.gov and establish, that's something that somebody should do every year prior to the open enrollment period so that they can understand, is there a better carrier out there, especially for that Medicare Part D. Now, if we go back to the B plan, and if they've got, what'd you call it, some kind of a condition that they can't pass underwriting?
Well, if they have a health issue that's a significant health issue,
they're not going to be able to go to another.
They're not going to be able to make a change.
Okay.
So let's go back to something you said earlier. If all the benefits are exactly the same and the only difference is premium, should you go with the least expensive premium? And I tell people, if they're choosing between the 4 or 5 or 6 major insurance companies in this country that are offering Medicare supplement plans, they're probably very safe if they then to go with one of the lesser premiums. But if you're looking at a company that has lower premium, but they're just not that major of a carrier, I would ask you to take pause, because as we pointed out, they may be locked into that carrier from forever, because they have now developed pre-existing conditions that's not going to allow them to make a change to a different carrier.
And can individual carriers raise their premiums for existing insurance holders? So let's say that you walked in and you said, well, I want that carrier because they're going to be $15 a month cheaper. And then all of a sudden, that wasn't a major carrier, and that carrier now starts jacking up their premiums. They're going to trap anybody in that plan with a pre-existing condition.
Well,
can they do that, regardless of what the other insurance companies are doing?
I guess the word trap is a strong statement. The reality is there will be adjustments in premium as long as there's medical inflation, and there is little in force currently to provide safety from medical inflation. But let's take that to the next step further. Let's assume that you and I both have a G Medicare supplement level coverage from company A, and this year you have $12 in claims, and this year I have $886,000 in claims. Well, Dean, both of our increases will be exactly the same from that carrier next year. And you could certainly argue that that's not fair to you.
Right. And
I could argue, yes, but this may be the year you have $886,000 of claims.
I took better care of myself, though.
Well, and you're younger. The increase will be, first of all, the carrier will have to go to the Department of Insurance of that state and mathematically demonstrate why they need a rate increase. And as long as there's medical inflation, they're probably going to be able to do that. But they're not going to be able to use your large claim against you.
But they could do it based on the claims of of everybody that is in their insurance company, right?
The pool of claims. That's right.
Yeah.
And
it doesn't have to be the pool of claims with companies X, Y, and Z. It's just
their pool.
Their pool. Okay.
And in this example, it would be their pool of people that are in the plan G. All of us will receive exactly the same increase. And it's important to point out, they cannot, in my example, they could not exit me from coverage. They could not cancel my policy because I had large claims. As long as I maintain Medicare Part B, which is required, and as long as I pay my monthly premium to them, they must continue on the risk without consideration to the amount of claims I've had.
That makes sense, but if you've had that many claims, there's probably a pretty good possibility that something's going on where you're not going to be able to switch from one carrier to another.
Oh, I guarantee you. In that example, you're going to be renewing with that carrier each year. And I guess that's the point I was trying to make earlier. When you select your Medicare supplement carrier, don't let just the premium be your deciding factor. I always suggest people go with one of the top 4, 5, or 6 Medicare supplement carriers. Always remember, a horse is easiest to ride in the direction it's already going. And many people make this one decision. And for the Medicare supplement, that's their decision that they're going to live with. And it may be simply because they feel they have great comfort with that. Their friends or neighbors or relatives have enjoyed coverage with that carrier. But they may be with that carrier because they'll never pass or underwriting, medical underwriting. Medical underwriting is the same as a medical audit. When you fill out the questionnaire, the page for Medicare question or medical questions, that supplement carrier is going to have an extremely informed ability to make a decision. Are you insurable under their
guidelines?
Their guidelines. That's right.
Okay, so I think that pretty well explains the Medicare supplement plans. But there's a different, what we'll call a tie-in plan. It's the Medicare Advantage plan. Now you started to break that down in the podcasts that we did in season 1 here of the Guided Retirement Show. This Medicare Advantage plan, I think if I'm correct, the idea behind that is that the government's saying, look, we want to pay an insurance company to administer the claims, right? And so
right.
the government actually pays the insurance premium, if you will, for the Medicare Advantage plan. So if I use a Medicare Advantage plan versus a Medicare supplement, I have no premium.
In most cases in our marketplace, it's zero premium or an extremely low premium, a fraction of what you would be paying for a Medicare supplement.
All right, so if I'm looking at it at cost, why would everybody not just choose the Medicare Advantage plan? Are there advantages or disadvantages to the Medicare Advantage plan versus the Medicare supplement?
Sure, Dean. There's things that you should consider. With a Medicare, to contrast that with a Medicare supplement plan, any provider that accepts Medicare will be happy to receive the check from your Medicare supplement carrier. With a Medicare Advantage plan, there's two choices. One of which is an HMO-based Medicare Advantage plan. HMO meaning Health Maintenance Organization, and that is a select contracted pool of providers that Medicare Advantage carrier has contracted with. So you would pick a primary care physician who would act as your gatekeeper, certainly with your input. But when you needed to be referred to a specialist or needed to be hospitalized, recognize that you're going to go into the pool or the panel of contracted providers that have contracted with that Medicare Advantage.
So you may not be able to choose just any doctor that accepts Medicare. It's got to be within that group that is approved by that Medicare Advantage provider.
If you want it to be paid by them.
I mean, that's the idea,
that's
right?
the idea.
That's the idea.
And I say that with a smile. You could go out of the system if you chose to, and if you had the financial wherewithal to do that, but you would be paying 100% of that provider's cost. And
all right, so let me just draw a scenario here. Something's in my head, right? Now, so a lot of people when they're retired, they like to travel.
Yes.
Right?
Yes.
Now, I've got a primary care physician that's in my hometown. I'm on vacation, and I'm on the opposite coast, and I have a stroke, or I have a heart attack, or I have something happens, and I'm hospitalized, and I need care, and I'm unaware of what's going on. My spouse is worried about me, making sure that I'm taken care of. I didn't go back to my provider, my main doctor, and say, hey, is this person approved? Are they in the pool? Are they not in the pool? Is that a risk that person could be put into a situation like that where that might not be covered?
Dean, it will be covered. And to complicate your scenario on the next step, you have the heart attack. You're sitting in a restaurant, you're enjoying lunch with your spouse, and you have a heart attack. Believe me, the ambulance is not going to be concerned about are you in an HMO plan or who are your providers or what panel or what primary care physician. They're going to take you to the closest provider of health care.
And because it's inpatient, is that the difference?
No, there's coverage. A Medicare Advantage HMO plan will provide coverage for emergency or urgent care needs wherever you're at, and they will cover it as if you were in the Kansas City area in the panel.
Okay.
So you have the comfort of knowing if you have urgent or emergency care needs, you have that coverage. Now, they may at some point in time want to move you back when you're in stable condition and it makes sense medically and financially to bring you back to this area, which you probably would enjoy doing as well if the medical condition would allow it. They may want to bring you back to this market area for the additional services. But the point is, for the emergency care to stabilize
You're
the
covered.
emergency care or urgent care, you're covered.
So where's the disadvantage then?
To the HMO plan?
Yeah.
Well, there's an old study that shows that the American public, about 17% of the American public, is a perfect candidate for an HMO plan. The translation of that is they don't know how to predict or to choose a provider. They know under an HMO program, the providers that are in that plan have gone through a criteria. They're either board certified, board eligible, but they're the higher tier of physicians, and that's been decided upon by other physicians. So if I'm in an HMO plan and I need a cardiologist, I don't have a cardiologist of choice, and my next door neighbor may recommend one, but that cardiologist may have graduated number last in his class. Under an HMO umbrella, you can be assured that the cardiologist that you'll be referred to is a top tier, very highly respected cardiologist. But so what I'm saying is 83% of the population wants to be able to cast the final vote. If I want to gas up the Chevy and drive to the Cleveland Clinic, I want to be able to do that. And I don't want to be in an enclosed panel of providers. And that's really where the second choice under a Medicare Advantage plan comes to light. And that's a PPO, a Preferred Provider Organization. And under a Preferred Provider Organization, PPO plan, you have in-network and you have out-of-network benefits. The in-network benefits are generally very superior. And the out-of-network benefits, by definition, is going to be a lesser level of coverage. But you still have coverage.
Now, in these out-of-network, do you have a different deductible on the out-of-network than the in-network, or do you still have the same deductible that you've got to meet and then everything's covered after that?
Generally speaking, it's a percentage of the bill.
Ah.
So
it can get to be a big number if you're out-of-network.
Yes, it can get to be a big number. But you wouldn't choose probably to go to, if you were vacationing, you wouldn't choose to have routine care. You would only probably, if you were vacationing, would be in an emergency or an urgent care situation.
So it sounds to me like what you're saying is that the Medicare Advantage plans are good,
well, they're
right? But if people want control and they want that final vote, they want to know that I'm going to choose what doctor I want to go to, and as long as this doctor accepts Medicare, they're going to accept my Medicare supplement plan.
And I'm
good.
That's a positive for the supplement. In our marketplace, the 2 or 3 major Medicare Advantage plans, if you can find a provider that is not in that system, in network, you almost deserve a gold star. 11,000 people, over 11,000 people a day are going to turn 65, and we're not at the peak. The peak will be over 12,000 a day. Most physicians are not living under their own shingle. They're not a private physician.
Most of them are working for hospitals.
They're working
today.
for hospitals or groups of providers.
Right.
And those groups and those hospitals do not want to lose their bite of the senior market.
They love Medicare.
Well, they love Medicare. They're paid promptly. They're not paid as much as they want, but they are going to A, be paid, and B, they're going to be paid promptly. And they don't want to see that market erode away. So most providers, most hospital settings, and most group settings are in most of the major Medicare Advantage plans. An exception may be where a doctor is, I'm 6 or 8 months or 10 months or 15 months away from retiring, and I want to start winding down. I do not wish to add new patients. That's a perfect example of a provider that may choose not to participate. And if that provider is key to you, that would help you decide which Medicare Advantage carrier you would like to go with. And I advise people, simply call your doctor's office, ask for patient accounting, and ask which Medicare Advantage plans that specific doctor, not your office, but the doctor you're seeing, participates in. And you may find that he's in or she is in just one of the 6. Well, that would help me to guide me on which plan I wanted to go with.
These are really critical decisions that people need to make. So let's go back and draw this this picture. I chose an Advantage plan. Now I'm 5 years in, and I develop an illness that my Medicare Advantage plan, I don't like the providers. I want to go just now get a supplement.
Dean, you may do so if you could pass underwriting.
Right, but if I've gotten sick, probably not going to be able to do that.
Probably not. You're probably going to be able to stay in a Medicare Advantage plan from now on. Now you can change plans during the annual open enrollment period, but you are probably going to be pretty much locked into a Medicare Advantage plan and out of a Medicare supplement plan. And so that's an advantage to the supplement plan. Recognize that, and from a budget standpoint, I tell people when they're going into Medicare, for the major Main Street carriers, the higher tier levels of Medicare supplements, the F or the G plan, and I have to point out that the F plan is going away January 1st, 2020. For new enrollees, people that are eligible or already in an F plan may continue that. But if they go to a G level, which will be the next tier down, they may be in under that coverage from now on, but they can change carriers if they can pass underwriting.
On the Medicare Advantage plans, do you have to pass underwriting to go to a new Medicare Advantage plan, or since there's no premium, is it just you can change Advantage providers anytime you want?
One underwriting question: do you have end-stage renal disease? And I'll point out, if you're in a Medicare Advantage plan and you develop end-stage renal disease, they will continue to cover you.
Right. You're not going to get kicked out.
You won't get kicked out, but you will not be able to go into another Medicare Advantage carrier.
So it's critical that you pick the right one.
Well, I don't know statistically, I don't know how many people are going to develop end-stage renal disease. I know it's a growing number because that's one of the subsets of diabetes, and that's an increasing problem for the American public. But your point's accurate. When you are initially making these decisions, there's a lot of things to consider besides, my sister always used this carrier, that's one I'm going to go with. It may have been perfect for her and not perfect for you.
I don't think that's the way to make a decision.
Well, a lot of people, I agree, a lot of people make decisions without all the facts. And that's really the purpose of this podcast, is to try to provide them or drive them to more information.
So, Tom, you coach people pretty much daily through the ins and outs of choosing the right Medicare supplement provider. The interesting thing is that from a financial perspective, it makes zero difference to you whether they use a Medicare Advantage Plan HMO, a Medicare Advantage Plan PPO, a Medicare supplement. You're going to be paid the same no matter what they do. So your job is to counsel people, to help them understand the difference between all the different plans that are out there and help them make the right choice.
Dean, that's right. And the only agenda I can have is their agenda.
Which is the way that it should be.
Well, it should be. And I think the vast majority of people doing what I do take that very seriously. Sadly, I hear stories about people that interject their agenda into the equation as well.
I got a question. Why do I hear different people advertising different Medicare supplement companies as if there's one that's better than another? I mean, I hear that on the radio pretty much on a weekly basis. Somebody's advertising, their Medicare Advantage. I'm not going to name insurance companies, but they're advertising their Medicare supplement plan like it's going to be doing something different or better than the other. But you say it's standardized and the only difference is premium.
That's right.
So why would a company even advertise that then?
Well, they're trying to entice people to participate and purchase their product. It's not like any other advertising you're hearing on radio. They're trying to drive or move people into becoming their client, their customer, and they'll receive the premium for that, and that's how they grow and recognize they have investors and shareholders and stockholders that are expecting an increase. But if the
coverage is identical across the board, it would seem to me that my choice as a consumer is going to be pretty straightforward, and then I could, because that's for my Medicare Part B supplement, and then I got my Medicare Part D supplements. That's my prescription drug. So I might choose two different carriers because of the situation that I'm in. And you say most of the time that's what happens.
In majority of time, that's what happens. Not exclusively, but yes, that's what happens. And because your prescription drug usage is going to change over the years, it's not unlikely that you will change Medicare Part D carriers if you know that there's other choices out there that may better fit your needs. There are people that selected a Medicare Part D carrier 3 or 4 years ago, and they do not go on an annual basis. They do not go back to Medicare.gov and spend the 15 minutes to find out if there's a better fit, or
which should be just a normal exercise.
It should be a normal exercise. I encourage people to do it every year.
All right, Tom, this has been fascinating as usual. There's so much to know here. And what I would encourage people to do is, we got Tom's contact information here in the show notes. You can reach out to Tom, send him a quick email, however you want to get in touch with him, and talk to him about the position you're in. He can help coach you through making sure that you're making the right decisions when it comes to your Medicare Advantage plans or your Medicare supplement plans, and understanding, I'll call it the alphabet soup of the Medicare world. And do me a favor, pass this podcast on to your friends and your relatives. This is critical information that everybody needs to know. We've tried to put it together in the Guided Retirement Show here, where you can listen at your leisure, you can stop, you can re-listen. It's awesome. So share it with your friends, because the more people that can be educated on this, I think the better off we'll all be. So, Tom, thank you so much for being here. Appreciate it.
It's always a privilege. I get to come where the magic's made.
That's right. All right, there you have it. A lot more information, and hopefully you're far more informed about the different types of Medicare supplements that are out there today, whether it's the drug plans, whether it's the prescription drugs, whatever it is. I mean, it's complicated. Look, there's so much to learn here. We've got a great white paper, which you'll find a link to in the show notes. It's called Making Sense of Medicare. Also in the show notes, you'll find a link to our website. You can check out any upcoming live workshops that Tom Allen is presenting at. You can get your questions answered. All you got to do is click on here and get your questions answered. That's all in the show notes at guidedretirementshow.com/22. That's guidedretirementshow.com/22. And by the way, Tom Allen does some of these Medicare workshops in a format that you can just view from your computer. We call them webinars, I guess that's what you'd call them, where you're sitting in the comfort of your home or your office and you're listening to what Tom's got to say about Medicare. Listen, share this episode. People need to know all of the rules and the intricacies as it pertains to them around healthcare in retirement. Tom's the expert in this area. We're happy to have him on. We'll have him on more and more. And share this out with your friends and relatives, and make sure to check us out on YouTube as well, and subscribe to that YouTube channel. That way you can watch us do the show. It's sometimes more entertaining than just listening. Thanks for being here.
Investment advisory services offered through Barber Financial Group, and SEC registered investment advisor.